tracking the reaction to their sentencing for us.
Well, this story is what we started off the week talking about. 2 patients making history in the fight against HIV. Now, these patients stopped taking their medication after receiving stem cell transplants, but experts found no recurrence of HIV in them. Now, scientists linked to Wits University are part of this international research team. Now, let's get some background. Let's get some observation of, I suppose. Dr. Lee Fairlie speaks for the Wits Reproductive Health and HIV Institute, not involved in the research team, purely an observer. Dr. Lee, good morning, and thanks for your time. Now, I want to go, yes, finally we have a cure. I want to celebrate, but I'm feeling like I should be cautious.
Right, so this is very exciting news for the field in a number of ways, and I think that for many years scientists have really grappled with the concept of cure. There was the case 12 years ago of Timothy Brown, who was really the first person who had been essentially cured of HIV. And then there's the second London patient who appears to have been cured for 19 months. There is a third patient in the sort of works called the Düsseldorf patient who's been cured for about 4 months. So essentially what scientists were doing with these patients, the actual procedures were not aimed at curing HIV. They were in fact aimed at curing cancer. So the first patient had a leukemia, this patient had a Hodgkin's lymphoma, and basically it's quite a grueling procedure really to do a bone marrow transplant on someone. Timothy Brown, in fact, there were descriptions that he almost died on occasion and was very, very, very ill. This particular patient seemed to have had an easier course. These days, I think less toxic chemotherapy and immunosuppressive drugs, or drugs that actually dampen down the immune system, are used. And essentially what happens is that the host person's bone marrow is kind of wiped out and then transplanted with new bone marrow. Now, what was unique about this new bone marrow is that it had a certain mutation called the CCR5 mutation, which is a protein which sits on the human cells and really allows HIV infection into the cell and then allows replication of HIV. So when these cells were transplanted, both of those patients now had cells that actually didn't recognize HIV any longer. So they managed to clear HIV, and then they fortunately, well, Timothy Brown is on preventative therapy, so there is still a possibility that he could become reinfected.
I was just going to say, we could call it a remission of sorts. I don't know.
Yes, essentially, and I think there are a number of different ways that people describe it, and I think one of the most accurate are really remission or kind of virological control. So there are numerous. I think that these cases probably, though, represent the closest that we can get.
So these treatments, and just reading on what the field, what the scientists are grappling with is, they're not sure whether it was the chemotherapy, whether it was the radiation, whether it was the stem cell transplant, or a combo of everything. How do we pinpoint what has led to this remission?
Absolutely, and I think that's what's very difficult, and so I think that they are combing through all the different aspects of the evidence at the moment, really looking at what was it, and really what does it mean
for the
field going forward. And absolutely, and I think certainly Timothy Brown has been in remission for 12 years. This newer patient, it's 19 months, so I think people are still watching very, very closely to make sure that he doesn't have a viral rebound again and come out of remission again.
Now, also very interesting, Lee, I'm just looking here saying that the Delta 23 donors, that's the stem cell, are primarily found in Caucasian. We're talking white people. The London patient remission gives important insights into the mechanisms, they say, of cure. So what does that mean, especially for us in South Africa, Africa?
Right, so I think that certainly these are very niche procedures. They at this stage very experimental and are being done on very small numbers of people. And obviously with a bone marrow transplant, you need very high degrees of sort of correlation and things. So it seems that at this stage it would be very difficult to think of such a donor being able to donate potentially in the South African context. I think what it means for South Africa, so certainly there is some South African research that's ongoing around looking at cure, but it's been very much directed towards infants and pediatric patients, really with early treatment, and some of those results we are waiting for. I think reassuringly our South African HIV program is exceptionally strong, and so we know that although of course no one would want to be HIV infected, we know that HIV has become a chronic illness that is very well controlled.
People are living with it.
People are living healthy
lives.
We expect that people should live full and healthy lives, and there's also a lot of progress in the prevention field. So in terms of oral prophylaxis and a whole lot of other prevention methods coming down the pike. So I think we have to sort of be excited about these cure cases, but also realize that it is business as usual, and we have to make sure that for our population we continue to supply excellent treatment for HIV-infected patients, and then really try and prevent HIV with all the ongoing efforts.
And these could just be extraordinary cases. We don't know if these men have something in common, something else, another gene, another, who knows? I mean, science is science, right?
Absolutely.
All right. Okay, thanks very much for that caution. That's Dr. Lee Fairlie. She's from the Wits Reproductive Health and HIV Institute.